Welcome to the Strategies Technical Assistance webinar, Linking Arms, Strong Community Partnerships for Comprehensive Prevention Planning, brought to you by Strategies Technical Assistance, the California Department of Social Services, and the California Family Resource Association. Next slide. Just a few Zoom reminders. Everyone is muted to help eliminate background noise. Feel free to turn on your cameras. We love to see everyone's faces, but we also understand that that may not be possible. Communicate with us or others in the chat. So we really, if there's a comment you wanted to make, we do want you to sort of hold questions for our Q&A session. We don't want it to get lost in the comments. So there will be a time for some question and answer for our panelists as well as for OCAP, who will be presenting today. We also ask if you're able to, and it's not too complicated, to change your name to include your county so we can see who's representing which counties. Basically, what you'll do is you'll find yourself on the grid, on the photo grid. You hover over on the right-handed corner of your screen, and you'll see three little dots that'll show up. If you click that, you will be able to rename yourself. Okay, next slide, please. Just a few housekeeping items. This webinar is recorded and will be available on our YouTube channel. A link will also be sent to all of you who participated today to access that. We will put the PowerPoint in the chat in just a minute, and that will also be sent to you in the follow-up email, so you'll be able to get the slides for today. And at the end of today, we will be doing a SurveyMonkey, which we would greatly appreciate you filling out. This helps guide us on any changes we need to make in the future for our webinars. We want to know who's joining us today. So if you could please share your name, your county, and the organization you're joining us today in the chat. Again, my name is Lydia Marquez. I'm a Senior Technical Assistance Specialist with Strategies Technical Assistance. And I'm joining you today from Orange County, where it's actually very cold for once. I'm not sure where everyone else is, but I see lots of folks in here. I see some Ventura County folks, Napa. This is scrolling by super fast, and unfortunately my eyes can't keep up, but it looks like we have a wonderful representation from Monterey to Northern California, Contra Costa, Merced, Napa, Tulare. I feel like we're probably going to get every corner of our state represented today, which is amazing, and we're excited to hear about. Okay, next slide. So go ahead and continue to do that, and we'll continue to check where everyone is coming from. I'm going to pass this over to Lola Cornish from Strategies Technical Assistance to talk about strategies.
Yes, so good afternoon. Thank you everyone for being here. We are Strategies Technical Assistance, and we exist in two counterparts, one in Southern California and one in Northern California, serving the entire state. Our vision really is that communities would be united, families would be strong, and children would thrive ultimately. And how do we make that happen? Well, we support and inspire cross-sector networks throughout the state to advance community-driven action to strengthen children and families centered in equity and inclusion. And then you see our values are there. So we value accountability to each other on the team, as well as to the counties that we serve. Also, equity, very important to us within our team and without. So looking at questions of equity, how do we involve the community in decision making? Collaboration, which is one of the things that we enjoy the most, is getting diverse groups of people together. Community voice, which means that we listen to the people who are affected by the programs that we're creating. And finally, we are strength-based, which means that we will always look for the positive in a situation. And who am I passing it to now? Sarah Lockcraw.
Hi, everyone. Good afternoon. My name is Sarah Lockcraw. I'm with Strategies Technical Assistance, co-lead with Lola. And I wanted to just shed some light on a new tool that we'll have available in January. It's called the Community-Based Partner Onboarding Toolkit. It's a set of materials to build capacity for new comprehensive prevention planning team members, so they have the pertinent information needed to join the work and be a part of the work. This toolkit will include a helpful guide, a checklist, a one-page summary on various elements of the CPP, and a PowerPoint that can be tailored for your county. We will also include a short video on what the CPP process is and provide some historical context as well. As I mentioned, we're hoping to launch the toolkit mid to late January, and it will be available on our website. Next slide, please. All right, I'm now going to pass this over to Victoria Hartman, Program Manager with the California Family Resource Association.
Good morning, everyone, and thank you, Sarah. I am Victoria Hartman, and I'm here representing CFRA with my colleagues Michael Williams, who's our Policy Director, and Sadie Crow, our Program Support, and also Jordan Hossein Hedeman, who is our new Communications Coordinator. Next slide, please. So the California Family Resource Association is a statewide network of family resource centers and networks of family resource centers. So we're a network of networks that does networking. And our vision is a strong, cohesive network that promotes the success and well-being of families in all California communities. And so we do a couple of programs. We have grant funding. We also do policy and legislative advocacy statewide. So that's some of the programs that we do within our mission. Next slide. We currently have 155 CFRA members, and we anticipate there's about 500 family resource centers statewide, and so we're really hoping to expand more. But we currently have 110 FRCs and 30 networks with over 30 FRCs within those networks, and we have 15 individuals. Next slide, please. So our current programs, like I said, are advocacy, legislative advocacy. We're currently working on a budget campaign to include family resource centers in the state budget. Hopefully we'll be included in the governor's budget in January. We also have vaccine equity campaign funding for COVID-19 vaccines and outreach, and we have that for our CFRA members implemented through family resource centers. We also administer the COVID-19 relief funds from the state. We have training and capacity building, especially for the National Family Support Network standards of quality strengthening, family quality strengthening and support. And then we also have multiple committees, and we really are member-led and member-driven. So we have a lot of opportunities for our members to collaborate and share best practices statewide. Next slide, please. Here's our contact information. So there's me for program management, Michael as our policy director, Sadie for our coordination, and then Jordan for communications. And I'll hand it off to Hillary Conrad.
Hi, thanks, Victoria. I'm Hillary Conrad. I'm with the Office of Child Abuse Prevention, and I'm happy to be here today to promote the partnership between community partners and Title IV agencies. And I'm going to talk to you about the Community Pathway, which is an optional pathway to reach children and families sooner and deliver family-first prevention services. Community pathways are designed during the comprehensive prevention planning process, which is developed by a cross-sector team that includes tribes and individuals with lived expertise. I'm going to go ahead and, oh, someone moved the slide already. Okay. All right. Keeping me on task. That's good. Thanks. Was that Sadie? So a brief agenda today. I'm going to talk a little bit about how we wound up having this webinar, why we decided that it was important after hearing from CAPCs, FRCs, and CBOs. I'm going to talk about a vision and the purpose of the community pathway, some requirements based on meeting what we have to through the federal law for a community pathway, an example of a community pathway. I'm going to break that example down to a couple of different steps, and then a simplified version of how to fund a community pathway. Next slide. So back in May, CDSS, Strategies TA, and CFRA brought together CAPCs, FRCs, and CBOs to hear their thoughts about a community pathway. And they expressed to us what they thought would be opportunities and then also what would be concerns. So this slide is just a very brief recap for Title IV agents to hear what we heard from community partners during that conversation. And what we heard was that it's important to coordinate with other partners to streamline services. It's an opportunity that there's going to be additional funding that can fill gaps in different service arrays. The opportunity to reach a broader community through a diverse base of CBOs and raising up the importance of relation-based case management and not just information and referral. The opportunity to have these natural connection points within our communities that are marginalized and underserved. And then, of course, the potential to reduce neglect referrals into child welfare and the ability to reimagine how we are supporting and engaging with families. Next slide, please. On the flip side, the concerns that we heard was about lack of funding and how to sustain services and programs, organizational capacity and staffing for community partners, including CBOs, FRCs, and CAPCs. How will the responsibility of child safety be shared? And then also a concern about the perception from the community with this new pathway and this new way to reach children and families. So this webinar was created after gathering information from this conversation and dialogue and hearing a request from CAPCs, CBOs, and FRCs, which I'm now going to be referring to as community partners, and bring Title IV agencies and everybody together to talk about the community pathway and also hear examples from counties on how this partnership is already working. Next slide, please. So to start off, the vision of a community pathway was really to create other access points for families to be reached and to benefit from these Title IV prevention services and other preventative services. We wanted to offer an option for counties to meet the needs of families before child welfare system involvement and to also mitigate trauma. We wanted to make sure we were honoring and building upon the trusting relationships that exist between community partners and children and families in order to increase engagement and access to services. Next slide, please. So one of the questions that we heard during the main conversations was really about what is the role of an FRC or CBO or CAPC. And what we've discovered in just thinking through what would a community pathway look like, that really it's not just FRC, CBOs, and CAPCs, that it's really any agency that exists in a community that is already reaching families sooner. So some of the roles that we see for this potential community partner is really building upon the connections that they already have with families and making sure that those families are informed that these new services and this new pathway exists. So it's really an outreach effort that can be conducted by community partners. Another role is that actually being the face-to-face contact and the one that is engaging with the family to coordinate the services that are delivered. And then another role is really the community partner could actually be delivering and the EBP services as well as other direct services. And one role that is not listed on this slide is that community partners have a role to be participating in the comprehensive prevention planning teams to make sure that they're in that discussion about how to design a community pathway. Next slide, please. So this slide is just the requirements for a community pathway. So this is the best way for us to meet what the federal government is asking us to have happen with the federal law. So first of all, we need to assess what are the needs of the family and then figure out a way to provide that information that we receive during that assessment process to the Title IV agency, who is going to determine whether or not that child and family are considered a candidate. Then another requirement of the community pathway is that, once again, that face-to-face contact and that coordination of service is happening by the community partner and not the child welfare agency. The delivery of service is also monitored by that community partner. And then safety and risk is monitored by the community partner as well as the Title IV agency. And then in addition, there's ongoing evaluation of services by the community partner to ensure that the needs of the children and family are being met and that the services are being reassessed to make sure that they are still appropriate. Next slide, please. This slide is just a visual of what one community pathway could look like. A community pathway could look very different depending on what is already working within your community. So I just want to reiterate the fact that this is just one idea of a community pathway. What we really want counties to be doing when they're designing their community pathway is to be thinking about what is already working within their county and leveraging what works, and which agencies are already trusted within communities. Next slide, please. So I'm going to break down that visual of the community pathway step by step. So in this first step, this is how does the family know where to go to receive services? So as part of the designing process, we really want to think about how does everyone know who the agencies are that are providing these services, and then what is the referral process to make sure that the families are then being connected to those agencies so that they can receive those services. Next slide, please. So the next step after that, after the family is referred, there would be an intake process. And as part of the intake process, the family can choose to participate in a voluntary assessment to determine their needs and which services would be appropriate. If information is provided during this intake process that indicates tribal membership, then the tribe would be contacted. And then the tribe is given the opportunity to participate in the family assessment, the case planning, delivery of services, and any safety and risk assessments. I just want to mention that there's no required assessment tool. So once again, this is an opportunity for community partners to leverage what's already working and the intake process that they're already completing, or they can design something else that they feel would better meet a particular program. Next slide, please. Okay, so once again, this is where the Title IV agency becomes involved. So the community partner sends information to the Title IV agency for review, and that information is gathered during that intake process. And it is then up to the Title IV agency to make the decision of whether or not that child and family would be considered a candidate, and then sends the information back to the community partner. And this would all be completed in through an automation system. The interaction between the Title IV agency would be protected using a unique case identifier through that automation system. And the family would also be made aware that their information is going to be sent to the Title IV agency. So during the comprehensive prevention planning and designing of the community pathway, this is an opportunity to consider not only how could candidates be served, but how could other children and families be served as part of a comprehensive prevention plan. Next slide, please. So once candidacy determination has been made, then the community partner coordinates appropriate services through a prevention plan. If tribal membership has been identified, then the community partner would work with the child's tribes. This is also, like I said previously, if the design is for the community pathway that's also to serve non-candidates, then you would also be creating a prevention plan for non-candidates as well. I want to point out that it's really not about adding a bunch of new services. It's really leveraging and coordinating services that are already existing as part of these community partners and what they're already providing to the community. Next slide, please. Okay, so coordinating the services, the community partner is the one that is coordinating the services and continue to provide that in-person, face-to-face contact. They're also conducting case management and monitoring risk and safety and potentially doing safety planning if necessary. So this is another great opportunity when the community pathway is being designed to really think about incorporating the tenets of county's 2083 MOUs. For example, the coordinated screening and assessment, the care coordination, the data sharing, and then resource leveraging, et cetera. So I just want to point out again that when you're designing your community pathway, it is really thinking about what is already working and what other cross-system initiatives have been happening, and leveraging those instead of starting from reinventing the wheel. That doesn't necessarily need to happen. Also, another piece of the coordination of services is really the shared responsibility of monitoring risk and safety. So not only is the community partner monitoring risk and safety, but the Title IV agency is also responsible to do that as well by looking at data that can be pulled from the CARES automation system. Next slide, please. Okay. Services are delivered, including EBP appropriate services, and if part of the design is additional services as well. But one of the key points to mention as part of FFPS is that the services must be delivered to fidelity, and that fidelity is mentioned within the contracting between the community partner and the Title IV agency, and it is the responsibility of the community partner and the Title IV agency to be monitoring that fidelity. Okay, next slide, please. And then finally, as I mentioned earlier, there's a monitoring of safety and risk. So there will be training provided by the state for community partners to learn how to develop safety plans and monitor safety and risk. And then also the traditional mandated reporting protocols are already in place. I'm going to make an assumption that community partners already have ways that they are monitoring risk and safety. And then they could also possibly hold a coordination team if there is a concern that reaches the level that there needs to be a referral to child welfare. Another piece of monitoring the safety is that there's aggregate reports that could be generated from the automation system that are going to demonstrate that safety and information on services and that model fidelity is being monitored. So that's one way for the county as well as the state to be monitoring risk and safety as well, and progress of services. Next slide, please. Okay, this is a simplified example of how a community pathway may be funded. Figuring out the contracting approach should be a part of your comprehensive prevention planning process so that the Title IV agency is able to contract with community partners that are embedded in neighborhoods that already have trust with the families in that neighborhood. One example to mention is that child welfare could contract with an umbrella CBO that subcontracts with smaller CBOs. This way that the money is getting down to the agency that is actually reaching the families. So for the way that this would work is the Title IV agency would disseminate information about the contract through an RFP or RFA process widely, and making sure that those community partners that are in those neighborhoods and have already built the trust are receiving the information. And then the Title IV agency is going to contract with the community partner to provide the prevention services. And then the contract community partner would send invoices back to the Title IV agency, and then the Title IV agency would reimburse the community partner. So there's a lot of flexibility in what could be put into that contract based on whatever design was created for the community pathway through the comprehensive prevention planning process. And then finally, the Title IV agency would claim back to the state for services cost and would specify which funding sources were used specific to the block grant and Title IV funds. Next slide, please. Okay. So I just want to mention some key elements for the community pathway. I've told you about the vision, what the state hopes to accomplish by expanding upon the federal law and having this option of accessing families sooner and preventing child welfare involvement at all. You've heard of one possible community pathway that could be implemented, but there's other ways that if that works better within your community, then that would be the best way to go. And then finally, you've heard how funding may flow to the community partner and service providers. So some of the key elements for the community pathway is funding. And as part of FFPSA, that provides access to Title IV funds and the block grant. But really, that's just the beginning. So when counties are designing their community pathway, they should be thinking about other funding sources that already exist and the services that they're providing. So first 5, education, Mental Health Services Act. What services are they providing that could be included in the array of services that are delivered within the community pathway? And then for data, that part of that automation system is going to include child-specific data, which may be something new for a community partner to be doing. And then that data is actually shared with the local Title IV agency. Next slide, please. Okay, some other key elements of a community pathway is, once I'll say it again, that they can all look very different, but the end goal is really to increase access to services for families and meet their needs sooner. And for some counties, this may look very different. And if you don't have a FRC infrastructure, it may be something more similar to a differential response. And then finally, the service coordination is the role of the community partner. And this service coordination could build on what is already happening and working for those community partners and those service providers. And the last thing I want to mention is that the whole purpose of the community pathway is to reach families sooner, prevent child welfare involvement, and making sure that we're providing services first and then thinking about funding later. So what are the ways that we can braid and blend existing funding in order to provide a more comprehensive service array to these families sooner? Next slide, please. And that is all. And I thank you for having me here today. If you have any questions, you can email me at the Prevention Services mailbox. I think I can drop that in the chat. And I hope you enjoy the rest of your webinar. And I believe I am passing it to either Sarah, Lola, or Victoria.
Excuse me, actually, it will come back to me. So we are going to just do a Mentee Meter. So for those of you who are familiar, we'll drop a link in the chat so everyone can easily access that. And what we want to know before we go into our panel is, have you engaged community-based organizations in your comprehensive prevention planning process? And if you are a community-based organization, have you been engaged? So we want you to pick either yes, not yet, but we are in the process, or no, but thanks for the reminder. So if I could have everyone go ahead, you can go to Mentee, menti.com, and you're going to enter in the code 2305-5325. So it looks like we're getting some answers in, and it's so cool in real time. It's kind of going. So I love to see some of these go down and then go up. So it's really cool. So it looks like quite a few folks are engaging their CBOs, which is awesome. And we love to see that. And those that are not, we hope that there's some strategies today that can really help you pull that all together. So we love to see it. And we hope today will just be a support to help folks get involved with that. So I'm just going to give us a few more seconds to answer. So we'll just give folks just a little bit longer. And looks like it's starting to slow down a bit, but it looks like a majority are engaging, which is great and which is exactly what we want to see. So I will go ahead and stop sharing. And if you see the code, I believe you could still see the results as the webinar goes on. We're going to do another Mentee Meter later on today, so keep the code handy. We'll go ahead and do that later on. And so now I'm going to go ahead and pass it over to our team who will introduce our collaborative panelists for today.
Wonderful. All right, so I have the distinct pleasure of introducing our 6 panelists today. We're very excited to have them here and really appreciate their time and energy. We're going to be discussing the strengths, opportunities, and challenges of building strong community partnerships between CBOs and Title IV agencies. And so I'm going to just go ahead and introduce folks here. And I imagine we're going to do some pinning of those folks. So we have Cindy Sutcliffe from Humboldt County, Taffy Stockton from Humboldt Family Resource Network, Amanda Guajardo from the Child Abuse Prevention Council of Tulare County, Mireya Anaya, also from Tulare County Child Welfare, Linda Belch, Deputy Director of Child and Family Services, San Luis Obispo County, Lisa Frazier, Executive Director of the Link Family Resource Center and the Center for Family Strengthening. So welcome, everyone. All right, I'm going to get us started with our first question here today, and we'll have San Luis Obispo answer first, and then others can pepper in as well. So if you could briefly please tell the story of your collaboration, including what brought you to the table and your strengths and challenges as a collaborative team. So Lisa or Linda?
I pick Linda.
Well, I'm happy to kick us off. Thank you all so much for inviting us today. We're really excited to share the story of our collaboration, and I'll share just briefly. So I'm relatively new as the Deputy Director over Child Welfare here in San Luis Obispo. I'm just closing out my 3rd year, so I consider that relatively new, whereas Lisa has been engaged in this work of family strengthening for a lot longer, and I will let her share that story. But that's really one of the things that I have really appreciated is Lisa's ability to be patient with my 10,000 questions, help me understand the history of what we have tried, what we haven't tried, and really is just such a wonderful thought partner and is always willing to listen to my crazy ideas and help me figure out how to actualize them. Our county was part of the 2018 prevention forum that was put together. I wasn't able to attend that. I kind of came on board after that, but there was a lot of great foundational work done as far as asset mapping. And then fortunately, when I came into this position, Lisa was willing to really sit with me and help me understand where we were at, some of the challenges that had been uncovered. And really, we meet regularly. She and I meet at least once a month, in addition to other collaborative meetings, just so we can brainstorm and catch each other up on what's going on in our respective roles. And one of the things too that I think is helpful is to understand structure. So in our county, our CAPC is separate from our child welfare agency. I know some other organizations are structured a little bit differently, which is really helpful because having our CAPC be a nonprofit, they're so much more nimble in ability to kind of get in with our CBOs, meet with our families, adapt really quickly. Whereas when you're the county, we're pretty red tape heavy in terms of government processes. And also, as I openly share, being child welfare comes with a set of kind of expectations when you're working with families, no matter how wonderful and engaging and best practice we are as an agency, we're kind of scary. And so having our CBO partners really be able to be that friendly face has been incredibly helpful. And so I'm going to go ahead and tag Lisa now to share her part of that.
Thank you, Linda. And what I can bring to the table is just doing this for 20 plus years, and I've learned and I've stuck with it. And I think that's what the value I bring to this. And my perspective and focus has always been to learn how to be a better child abuse prevention counsel. And we've developed that over the last 20 years with a group of very powerful, committed folks through multiple funding streams, as we have been talking about here, that are prevention focused. And so today, what was a very teeny tiny CAPC is now a full-blown organization that has a responsibility for countywide parent education resources, which are primary prevention resources. We manage a family resource center with 12 bilingual family advocates. It's not the same CAPC I started with back in 2001. What I can share is that over the years, this is my third deputy director, and Linda is definitely a breath of fresh air with her open-minded approach to what we can do to elevate prevention and reduce the entry of children into our foster care system and into juvenile hall. That is a shared goal, not that I just share with her today, but with all of our colleagues. But it always was a little challenging because the learning curves that we all had to go through these last, at least for me, 20 years, is how to elevate that along with the other tables on how we do these type of services. So that's what I can bring to the table, is just this seasoned experience, which I have developed, not because I stuck with it, but because I've had colleagues in the field, and many of you are on this call, are part of that. That's helped me grow, and of course the support of OCAP and their leadership has helped led us to this point of this webinar today. And lastly, I can't say enough about how important it is to have a leader in your Department of Social Services who's willing to see the community partners as equal players, especially as prevention providers. It was something that was a big challenge for me personally, and I get it because everyone was doing what they had to do in front of them, these past 20 years. But this is a new era, and I'm really thrilled to have arrived here at this time with everybody and with my colleagues across the state. And I'm just looking forward to taking next steps as we build this comprehensive prevention planning process.
Wonderful, Lisa. Thank you so much. I'm going to now ask for our folks from Tulare and Humboldt County. Anything else you would add in terms of the strengths and challenges as being a collaborative team?
I can go. My name's Maria Anaya, and I'm from Tulare County Child Welfare Services. I have to say I echo what Linda from SLO County mentioned, in the sense that our county is also separate from CWS and CAPC. CAPC is a nonprofit, and it definitely has its benefits in the sense of, with child welfare services, we have red tape. We're very heavy with that. And our CAPC, and it's not just our CAPC, it's our other community-based organizations that really have a trusting relationship with our community members. And that's very helpful for CWS because we can bridge the gap to really reach our community that way. We also rely heavily on our community-based organizations. So CAPC is one of them, but we also have the FRCs in our county. We have Parenting Network, CSEP, Family Services, CASA, TICO, CVRC, Prevention, Tribes, and Behavioral Health, just to mention a few. For me, I haven't been in this position that long, just about 2 years. so for me, I was very fortunate to have our predecessors in CWS really work on establishing those relationships with not just CAPC, but our other community-based organizations. So they've really taken that relationship forward because there's a huge value with that. Because as child welfare services, we can't serve our community in silos or just by ourselves. We really rely on our community-based organizations. And, you know, CAPC is also one of them, and they've been putting out a lot of messaging along with some of our others. So that's, you know, what I'll add. I know Amanda will probably add a little bit more to that.
Hi, thank you, Medea. Hi, everyone. My name's Amanda. I'm the director for Tulare County's Child Abuse Prevention Council. And I'm just so excited to be able to share some of the work that we've been doing around collaboration, and mainly the difference that it has made in how of our activities that we do in our program, and how it has influenced change in our community, really. I remember coming into this position almost 5 years ago, and nobody knew what to do with CAPC. Nobody, you know, our name says what we do, but we hadn't done a really good job sharing why we do the work. And so what we, and I say we because at that time CAPC was just me. So I understand, Lisa, when you say, you know, CAPC is very different than what it was when we took over the leadership of it. But what I decided to do is to just be really, really proactive in sharing not only what the WIC code, the Welfare Institution Code shows, you know, what recommendations are, but in bringing on our partners, I made sure that every one of those partners had a copy of the best practices of child abuse prevention councils, and we had intentional meetings on different parts of it so that I knew what to expect from them and child welfare services in particular, and they knew what to expect from me. So that helped so much in just developing that relationship. We have the same purpose to communicate to all the residents of Tulare County the vision and the plan for preventing abuse and neglect by promoting healthy families and communities. So since collaboration was such an important component of our work, we have focused on relationship building, and that can be from Medea and I just meeting once a month on the phone, or maybe going out to lunch and just saying, what are you guys, what is CAPC up to right now? What kind of funding streams are you hearing about? So we, and again, have been really, really proactive about just making sure that communication is open, and that we're just really, really transparent. I think being transparent, we included child welfare services in our strategic planning for our nonprofit. We had a nice representation from them, and I think it made them get not only engaged, but a feel of trust. And now we are, really taking ownership of our work that's listed not only in the Welfare Institution Code, but trends that are happening. So we definitely have fostered that sense of shared purpose. And I'm really, really grateful for that.
And I'll pop in from Humboldt County since I'm a little bit of an outlier on this panel. So I coordinate the network of family resource centers in the county. So it's a network of 16 community and family resource centers. And we have had an existing relationship with CWS and the rest of our Department of Health and Human Services since our start as Healthy Start programs back 30 years ago. And over those 30 years, there has been an immense amount of trust and relationship building that has happened between resource centers and all departments of DHHS that don't just happen when wonderful opportunities like this to build collaboration come up. They happen consistently. We have regular meetings, regular conversations, regular projects that we work on together. So from our side, when CWS was getting ready to roll this out and asked us to come to the table as not just a participant, but as a core piece of this work, we were absolutely in. They had spent the time making sure that we understood that this was meaningful and worth our limited resources, and had built the relationships to get us to invest those time. I will also say that Cindy is having a little bit of trouble with her thing. I'm going to see if she can talk in a
yeah, I can talk, and I'm going to talk really fast because I've been having some serious problems with the internet. But I'm here today representing the Child Abuse Prevention Coordinating Council, even though it says CWS there on my screen in the Department of Health and Human Services. I've been the president of CAPC here in Humboldt County for the last 6 years. My term will be ending soon. I've been working with CAPC, being the lead in the development of originally a primary prevention plan here, and the Humboldt Network of Family Resource Centers has been at our table on our board, as well as Child Welfare Services. So they've both been at the table while CAPC's been driving the boat a little bit around the creation of a prevention plan. Work started in 2018, went on through 2019 into 2020, and then FFPSA and FFPS showed up in 2021, and we all just kind of like hopped right on. So it's definitely been a team effort.
Yeah, the strengths of those relationships sounds like it makes it easy for people to come to the table quickly and respond quickly, work functionally together. Fabulous. Thank you so much. So I'm going to pass it over to my colleague, Lola Cornish, to take the next question. So Lola, when you're ready.
Yes, and this question we're going to start with to Larry, folks. So what have been the focus areas of your collaboration during the comprehensive prevention planning process? And then we listed a couple of examples: community engagement, community pathway, or evidence-based practices.
Thank you, Lola. This is Amanda. We found that engaging parents who speak and act from their perspective as parents, as opposed to coming from the perspective of a staff member from our organization or maybe other CAPCs, was what was going to be really powerful in partnering with Child Welfare Services. We have we're one of only 2 counties in the entire state of California that have a portable 10-minute multi-sensory exhibit about child abuse and awareness. And we are so proud of that program. And so what we did is we started to make sure to increase our community engagement by including foster youth, by including parents with lived experience in it. And because our CAPC has gained licensing to use in 9 counties in Central California, that collaboration has expanded. And so we're really super proud of the community engagement that we've been able to do. And the way we kind of initiated that with Child Welfare Services is that we provide as part of, so they require their staff to go through the LISA project as part of their mandated reporter training. And so we have a partnership where we not only provide it to CWS as professional development, but we also provide the support. You know, we do the trauma and resilience training throughout the community. And wherever we take the exhibit, we always let CWS know, because they bring that mental health support. Sometimes their social workers will be there to support those who experience the exhibit, because it's a very complicated exhibit about abuse and neglect. But we have increased our community engagement with that one specific exhibit. We were taking it out probably 2 or 3 times a year. We're taking it out twice a month now because of our partnership with Child Welfare Services and the fact that they understand the value and the impact of it. So yeah, it's just been phenomenal. We're tired.
Thank you, Amanda. I just wanted to add a little bit to that, to what Amanda was saying. You know, for me, I really feel that collaboration starts before any new initiative comes out. So, in regarding the CPP, so we've had that historical relationship that was built by our predecessors within our community-based organizations. And in addition to that, Tulare County is also fortunate to have specific staff. I mean, we call them policy and program specialists, who have really taken on the lead in getting our community-based organizations together with CWS, and them doing research and really taking the lead on bringing our community-based organizations and CWS together to the table to review the different evidence-based models, and to really communicate with our community-based organizations as to what would be the best fit for them. Because CWS can only do so much when it comes to prevention. We rely heavily on our community-based organizations, for many reasons. As I mentioned before, they have more of a trusting relationship. As much as CWS wants to, put their face out there as being friendly and we're there to support, we have a different relationship than our CBOs. The community trusts them a lot more. So we use that bridge, and they're really the face out there of our prevention services. And so, we're very fortunate to have them. And it's just really a collaboration amongst all of us. So I'll hand it over to the next person.
Yes.
I'll go ahead and go next.
Thanks.
Did I cut someone off? I'll say from the FRC perspective that what we've really been doing is community engagement. So when CAPC and CWS came to us, they trusted us to do what we do best, which is approach families. And so 13 of our resource centers held focus groups or one-on-one conversations with, and I looked this up before we came on, Cindy, 94 families from the FRCs. And that was truly and genuinely used when we started asking these questions. So these were families from all areas of our very rural, very underserved community. And their information and their feedback was really taken seriously, considered, used to shape the work that we're moving forward in our county. Cindy, would you add anything to that?
I would like to, thank you. I think one of the things that really was clear to me, and the difference, and this is from putting my hat back on, my CWS hat, was the adaptive leadership that was demonstrated here at CWS, so that we were able to, excuse me, pay the family resource centers to conduct the focus groups. We use the American Recovery Plan, Community-Based Child Abuse Prevention Act monies, and then also provided gift cards to all of the families and the foster youth and the former foster youth that participated. And that it showed a lot of flexibility and autonomy, because I knew coming back into CWS that CWS trusted not only the FRCs, because we also have 3 tribes that conducted focus groups that are part of our partnership, our community pathway, as well as our Humboldt County Transition Age Youth Collaboration. So it's a large group, and they were trusted to do the work, and they did an excellent job. And it is truly shaping the primary and secondary prevention service component of our comprehensive prevention plan.
That's great. Anyone from San Luis Obispo have anything to add?
So I can add a little bit. So one of the things that we've been really intentional about in our community is really coming to a joint vision with our partners in terms of not just child abuse prevention, but really that wellness concept. And what are those wellness indicators? So we spent a good deal of time really being clear on what that would look like, and then embedding that into our logic model and those components that are required as part of the CPP, and then working backwards from that, really thinking through what capacity we currently have, and then what capacity gaps would prevent us from getting where we wanted to be. And of course, one of the biggest drivers of capacity is funding. And then thinking about how to use that one-time funding we have to bridge those gaps. So we're investing quite a bit of our block grant after that collaborative conversation in purchasing and paying for training community-wide for like the motivational interviewing EVP. And really the purpose of that is so that we as the county and our providers as our community organizations have that common language and that ability to work with families in a very similar manner so that families have some kind of consistency no matter what organization they work with.
And I'll just build upon what Linda shared with everybody. It's arriving to this understanding that we have all this great information about our impact that's not coalescing very well. We need to really be mindful of what those indicators are. We're referring to them as wellness indicators or well-being indicators, and getting some shared metrics to use as a way to build our system of, well, we call it a safe system of care here in San Luis Obispo County. But we also have this child abuse prevention plan that we need to articulate what we are doing, but also build upon it, what we're going to work towards. Going forward, it's again, I want to go back to the desired outcomes that we all want and getting clear about what that is in front of us in our respective county. And it's great to hear about our aligned approaches here. And recognizing, and uniquely, this is what we'll do, and that this particular funding initiative is allowing us to do that. And I take this from my experience of when the Mental Health Services Act arrived in our county did not drive it. They organized us and let the community speak and let the community do the Mental Health Services Act funded projects. And I'm, of course, the organization I represent is does get Mental Health Services Act money specifically for prevention projects. So I can speak very highly of that. That's what really worked. And I'm looking at this as a similar approach where we do have a county agency like DSS to be that lead, and at the same time bringing our community in to be thought of as not just thought partners, but actually getting the work done and measuring it as we go along. So there you go.
Well, thank you all. Those are some great examples of collaboration for prevention planning. And now I'm going to pass it to Victoria Hartman.
Hey, thank you. So this question here is for our Humboldt County panelists, starting with them and then passing it off to Tulare and San Luis Obispo. So for Taffy and Cindy, how do you envision building the capacity of CBOs in the implementation of prevention strategies?
And that's a really good question. And honestly, that's why we're at the table. These prevention strategies, as we all agree, are the core of really strengthening our families and our communities. And so we're at the table because this is a conversation that we can't have by ourselves. This is a conversation CWS can't have by themselves. This is a conversation CAPC can't have by themselves. We as a county, as a state, as a country have to come together and figure this out. It's not an easy question, or we would have found the answer already and funded it appropriately. We need to have these conversations about how do we build the capacity, which includes clearly the funding. So we have employees at these individual sites providing these services. This includes making sure that we have this funding from year to year, that it's stable and solid and secure. So we're not always having to end one program to start another one. And we're at the table to address this question. This is what we want to do. And I've been really impressed with the tactic our county has taken, which is to look this really difficult question right in the eye as we get started and really integrate it into these early conversations. How are we going to sustain this work? nobody has the time or the resources to put a whole bunch of work into what is a lovely plan that we'll never be able to implement because there aren't enough resources to continue the work. And so for us, this is our opportunity, while there is funding and while there is will behind it, to have these conversations and find those long-term stable solutions for our organizations and by extension, our families and our communities. Cindy, what would you add to that?
I want to piggyback on what Taffy just said. You know, we need the development of a larger sustainable funding source for FFPS, and because the drawdown on FFPSA is not going to fund this in perpetuity. I mean, it will take a little bit of it, but not a lot. And the suggestion, which makes a lot of sense, of pooling all of the prevention dollars that come into the county through child welfare, through the County Office of Education, through Mental Health Services Act, through mental health, and through public health, as well as probation, also doesn't create a large enough pool of dollars to be able to continue the work that we're implementing over the next couple of years through FFPSA and FFPS. So it was really encouraging to hear early on that, you know, CFRA is looking towards or has been advocating for the governor to put additional dollars in the January budget to be able to fund family resource centers. They're our primary source for our community pathway here in Humboldt County. There's 16 family resource centers, but we also have the 3 tribes, 2 of which have casinos, but 1 does not. And then we have the HC Tacey. So it needs to be kind of broad and expansive as far as how these funding dollars, you know, that might be going into the governor's budget can be utilized within communities, because I know some counties probably aren't necessarily linking with their family resource center as their community pathway. I mean, it makes sense here in Humboldt. Anyway, we need to be looking at more permanent, sustainable funding beyond, like what Taffy was saying. We can't just run around and chase grants all the time. It's too exhausting, and it does lead to the end of programs, which is not what we want. We want this thing to live on well beyond all of us. Anyway.
I guess the only other thing I'd add to that is I'm really appreciating the investment I'm seeing in systemic change and better communication for our organization so we can better do this work. So for example, one of the things we're looking at in Humboldt County is a CIE, which was a project that was already rolling out, but aligned so well with the work that we're seeing that be a really positive piece to be including in our conversations. And so pieces like that we're able to invest in that long-term will impact our ability to do this work more effectively has been really nice as well.
And then I just want to say one last thing. When Taffy mentioned the CIE, one of the other things that we've done is I have pulled together the fiscal analysts within the Department of Health and Human Services. So we have social services, we have mental health, and we have child welfare services, as well as bringing in a new fiscal analyst that the Humboldt County Office of Education just recently hired in their prevention and intervention department, and then having the fiscal analyst from probation. And they're all going to start meeting in January. And they're going to be charged with looking at sustainability. We already braid funding, but we're going to braid it a little bit more. And then looking to ways to be able to shift funding to be able to create sustainability for this.
And I'm going to tag in for 3 more seconds just to apologize. Yes, a CIE is a community information exchange. Sorry, too many acronyms. And it's something similar to what like a health information exchange might be for medical records, only it's built specifically for social service organizations to be able to do shared case management and referrals back and forth and share assessments, that sort of thing.
Thank you so much, Taffy and Cindy, for sharing your insights into this question. CFRA and strategies and the prevention planning FFPS, it all kind of ties together in a lot of the work that we're doing for sure. Let's hear from Linda or Lisa, or both, from San Luis Obispo on your perspective for this question.
Thanks. And I'll go ahead and jump in just to share a couple things. Some of what needs to be done in order to build that community pathway or these collaborative costs $0. So let's be realistic about this. Taking time out of my schedule a month to talk with Lisa on a regular basis, showing up for the community forums, helping, tap in with some administrative support where it's needed. Those are things that I'm, already charged with doing, and we just need to prioritize our time. And so I think that that's while we're talking about building capacity of CBOs, I do think that we need to recognize there's some things that we can do that have not a cost associated, although, time is not an unlimited resource either. But really prioritizing that relationship is key. Outside of that, we're really looking at the sustainability piece up front. And so we've talked with our partners at behavioral health around, is there any MHSA funding that could be available? Is there existing services that maybe aren't functioning as well as could be intended that could be, shifted? And just being really open with that dialogue. I think those are all pieces. And eventually, hopefully when prevention works incredibly well and we see our children coming into foster care at a lower rate, there's going to be some savings there potentially. And then really tracking that and looking at how those dollars can be shifted to continue those upfront services.
Thank you, Linda. I want to just add that being able to communicate with Linda in her role in a very confidential and yet safe place to talk about the actual cost it takes to do this work has been a breath of fresh air. To articulate what it really costs to run a family resource center, what it costs to employ people with bilingual, bicultural type skills and that expertise, and the costs have risen in salaries to employ folks recently since COVID has hit us. We've also talked concretely recently about okay, you want these family resource center services to be accessible, and where do they live? If they're brick and mortar, we need to be very mindful of that strategic location. I don't believe we really been thoughtful about that the past 20 years, but what is in place is in place, and it's better than nothing, and it works. But going forward, what can we be doing to improve upon that? And even Linda, and I talked about, what is the possibility of a mobile FRC in our rural, remote areas here in our county where you're really far away and there's not very good internet access, et cetera. And what I want to do better is to actually practice this conversation with data. So we're making informed decisions about the regions where the needs are. And we are doing that. That's actually a practice we have started to do through our child abuse prevention planning table. And that has been not just so much eye-opening. Anecdotally, we really understand where the issues are, but to be able to understand that concretely through data sharing or data mapping is something that we're going to do together as opposed to separately. And just that, being recognized as a nonprofit that when I started back in 2000 was very tiny. We had a $35,000 budget. That's not the case anymore. That comes with it a lot of responsibility, a lot of organizational oversight, and the tasks to continue to connect with our community who do privately support what we do, and leverage that with our I think it was Cindy from Humboldt was sharing about pulling together all the fiscal gurus up there from the different agencies to really think concretely about how to braid this funding. And it'll be really exciting to hear about your journey with that. And yes, but again, the community-based support is a significant contributor to this work. And that's where I think as a private nonprofit, we have that ability to bring in that support that way, not just through money, but just actual ambassadorship of individuals like the parent voice. So thanks.
Thank you so much for sharing, Linda and Lisa. I think we're a little bit behind schedule, so I would have loved to hear from Amanda and Mireya, but maybe you could add some of your perspective to this question in the chat. And I will pass it off to Lydia for Q&A.
All right, so we have about 10 minutes. So if you wanted to ask questions or explore anything further with our panelists in regards to their collaboration, their relationships, how they built these amazing partnerships and how they continue to nurture these relationships, please feel free to put them in the chat, and I will go ahead and read those off to our panelists. I know there are so many great questions or comments that we saw in the chat so far. Just talking about how a lot of folks wanted just a richer understanding of, how the community pathways may look when we are talking about these kinds of relationships. And so Lindsay Call from Kern wanted to circle back to the community information exchange. What does that look like and what tech tool is used for that? So
I guess since I started that one, I should probably take that one. So we actually have a coalition in our county that has been working on building this community information exchange for something like 4 or 5 years. They spent some time doing some research and getting stakeholder feedback from something like 50 different nonprofits locally. So this is one of those things that was a really happy kismet that it came about at the same time and is going to be coming to fruition. They just onboarded their first couple of nonprofits. There are a number of tech tools that are specifically set aside for it. We are working with one called 9Patch locally. It's being headed up and backboned locally for us by the organization that also runs our health information exchange. I'm more than happy to share more information about that. I don't know if they can share my contact information afterwards, but I'd be happy to put you in touch with them. I don't want to spend all of our Q&A time digging into it, and it's kind of one of my pet projects, so I'm afraid I'd take a lot of time if I try and dig into it.
If you're okay with sharing your information, Taffy, we can send it in our follow-up email. So you'll get a follow-up email and we can put that in there.
I'm also happy just to put it into the chat as well. So please do feel free to reach out to me directly if you're interested.
Great. And someone just asked, how do we help our county move the needle to include CBOs in the process when they have designated funds to support county internal efforts? I think it's just asking about how do you nurture that partnership? I'm not sure who wants to take that one.
So is it, how do you, sorry.
Go ahead.
I'm actually going to put it in, it was sent directly to me, so I'll put it in the chat so you can all see that for yourselves.
This is Lisa Fraser in San Luis Obispo County. I take that responsibility to reach out to people that aren't at the table already or maybe really new in the community. And then it's, for example, our indigenous people, and including the tribes in San Luis Obispo County, we didn't know where they were because it's not really heavily represented. And we finally, after several attempts we tripped upon each other's in a cross somehow just down the street. And that was literally how organic it is connecting and introducing myself. And now the representatives of the North Fork Rancho area Mono Indian tribe is now part of our child abuse prevention planning process, new as of last month. It's really taking that time and getting out in the community and finding those individuals who we want at the table and just introducing yourself. That would be one example. Another example is I got re-engaged with a Quest to College an instructor who has been a longtime colleague in many ways, and she wanted to be more connected. And I said, well, I have the perfect table for you, and we really want you there. We want your feedback. And she has arrived, and she's going to be part of our child abuse prevention planning process. It wasn't like she was an identified partner or Quest to College was in the beginning. but as people move on and move off, you really have to go out and reach out to them. And I know Linda does her part. We all do our part, but I really make that a priority for what it is necessary to have our ambassadors from our different agencies be at the table, and understanding if it's too challenging for them, not to give up on them.
I want to agree with what was just said. CAPC's been working on the creation of a prevention plan since 2018, and we've had First Five at the table. They serve on our board of directors. We did a lot of outreach in 2021 to the tribes to invite them to be a part of the process. Work moves at the speed of trust. You have to be able to develop those relationships. And so what Lisa was talking about with regards to the ambassadorships, it's absolutely critical. You need to be out there. You need to get to know these people. You need to understand these agencies and their direction. And you're going to have a place at the table for them in the creation of the comprehensive prevention plan. Our service gap analysis that occurred from the focus groups over this past summer identified a variety of areas where agencies already are providing service. And so I spent the last 3 to 4 months meeting directly with the directors of these agencies or these departments or these organizations, or things like our local credit association, to invite them to be a part of our cross-system collaborative, because something that came up at those service gap analysis, the focus group said, we need somebody at the table that can, fill this role. And, anyway, like Lisa said, you've just got to get out there.
So I know there's quite a few questions about the community pathway. So I'm not sure if we want to maybe try one general one. I don't know if Hillary is available to answer one of the questions about the community pathway. If not, we can definitely share those with, oh, there you are. I think there's some questions about how, I guess, the responsibility of the fidelity of EVPs. There is a question regarding, sorry, I'm trying to scroll through all of these, make sure I capture it. Is child welfare entering everything into CARES? And are parents able or families able to consent to that in order to have Title IV funding? And then just talking about the who would serve as an entity as a Title IV coordinator. Is it always child welfare?
Okay, so the first question was about model fidelity and tracking model fidelity. We're currently having conversations about what that is going to look like. But the idea is using the automation system currently to possibly track the indicators for the different EVPs. So it would be the one who's actually delivering the evidence-based practice that would be putting that information into a system. And the next one.
I think that was very specific around pass-through funding. So I'm not sure if you wanted to hold that one, I could pass that to you. But there is one question I think that is important about how the state is I guess, to what degree is the state requiring meaningful collaboration between child welfare and CBOs doing the work?
Well, within our all county letter, I think it's 2223, we mention who is required to be part of the comprehensive prevention planning effort, and it includes community partners such as FRCs and CAPCs. Great.
And then for some of the panel members, someone had asked about engagement with First Five in your county, and just asking more specifically about, is First Five engaged, and how does that happen?
In Humboldt County, we've had First Five on the CAPC board for decades, and they were also a key organization when we did our original planning work, our prevention planning work in 2018, 2019, 2020, and back in 2021. I think it's absolutely essential that you have your first fives as one of your partners. In some counties, not in ours, but in some counties, funding for family resource centers comes through first fives. So having them there is critical. But they also, in our county, they're going to be offering parents as teachers, which is an approved evidence-based practice that's in the California 5-year plan. That's going to be, coming up. They're going to start implementing that in the spring. And so we've included them in our plan. We're not exactly sure how we're going to be, supporting that. We might be utilizing Title IV drawdown after CARES is up and running. We might be just using state block grant monies to be able to get families into parents as teachers if it's necessary, because of course they have a funding source already for that too. But anyway, yeah, first five, absolutely essential. Have them there.
Great. Thank you so much. I'm gonna thank you all for the wonderful questions. I think they brought up some really great points, but that the panel was able to really reinforce, and that is just we need to get all of the community together, and so to do this work, because it definitely takes a village. So I'm going to transition us next to our breakout session, and I believe that Sarah was going to transition us into that.
Thanks, Lydia, and thank you, panelists, very much for thoughtful responses. Are appreciated. So I'm going to just give a few points before we get into our breakout sessions. You'll see the questions there. At this point, we'll have probably about 25 minutes or so for the breakout. You'll be randomly assigned to your groups. There will be a facilitator present to support your discussion. And if need be, you can always come back to the main room for tech support or if you have any other issues. So with that, I believe Anvi is going to take us into breakout. So give a few minutes for that to happen, for folks to get settled in.
Well, thank you all. I hope you all enjoyed your breakout sessions. Thank you all for hanging in there. We wanted to just get back together again and do another Mentee Meter before we leave. And what we'd like you to do, we'll have someone drop that into the chat for us, is just share, it could be a few words about how you'll sustain your community collaboration, your partnerships. And we have a few people that have started sharing already. So it looks like folks are beginning to populate that as well. And I'm going to let Hillary kind of take over and looking at some of this stuff and sharing what people are talking about.
All right, thanks, Lydia. It's been a great webinar. I learned a lot today. Appreciate San Luis Obispo and Humboldt and Tulare all sharing their stories about collaboration. So what do we have on here? How will you sustain your community collaboration? Relationships is big. Engagement, family focused. Resource fairs, continuing to elevate voice. Inclusion, trust, being the lead. Partnerships, discussions. Centering racial equity, support, outreach, engaging with others, planning, maintaining the course, center equity and social media. Oh, a lot of great ideas. Keeping up collaboratives include new agencies, pulling in those new partners. It's great. Being open-minded. Centering lived expertise, that's a great one. Respect, I'll end on that one. I think that's key for any great partnership and collaboration.
This is great. Thank you all. I see communication as like the biggest word. So we know that that is definitely important to collaborating and continuing to get this work done. So we will have our strategies team close this out with a few important reminders.
Sorry, I couldn't unmute myself. So what we're looking at for our closing reflection is, what are some strategies you heard today that you can begin to use in building collaborative relationships? I think that I heard in the group that I was in, there was so much rich conversation about equitable levels of service, about who's at the table and not at the table, how to make them feel comfortable at the table. Trying to figure this all out, and how are we going to pay for it as well was a big issue. And some very interesting information about outreach to tribes, to those with lived experience, and also some technology tools that were shared with us. So thank you, Sarah. You can put your answers to the question in the chat if you so desire. So we do want you to keep in touch with us. We will be emailing a complete SurveyMonkey evaluation that we'd like you to do. We will have the recording up on our YouTube channel as soon as humanly possible. And again, you can find us at our website. You can sign up for our newsletter, follow us on social media. Thank you, Anvi. She just put the SurveyMonkey link in the chat. So if you'd like to do it now instead of waiting until later, you certainly can. And then can we put the FFPS email back into the chat also? So if you have questions, that's a good place to submit them. Now, going back, so communication and building relationships, patience, strong feedback loops was another suggestion. Trust, reaching out to CAPCs, lifting the parent and youth voice. Keep showing up to that table. Yeah. Continue to build the members at the table. Everyone has part in this work. Aligned approaches and clear expectations. Community information exchange. What sort of information? So we can perhaps learn some more about that. And there's the FFPSA Prevention Services email inbox. It's a great place for you to submit questions that are specific to the Title 4E agency and the plan itself. Okay. Any closing thoughts from our panelists or our team?
Well, first of all, I want to thank our panelists for their time. We know how busy you are and the amazing work that you do. So thank you so much for that today. We also want to thank our facilitators who helped with the breakout rooms as well. We appreciate that support. And also to Hillary Conrad for that, I think, really informative presentation on what a community pathway could look like. And I think a lot of our teams truly appreciate that concrete example. Again, please look out for the link for the YouTube so that you can take a look at this again when you want to remember the amazing strategies and stories shared today. And again, thank you all for joining us this afternoon, and we look forward to seeing you again soon. So thank you. Take care.